This is Neil Osterweil with the Global Medical News Network. I'm here in Orlando, Florida at ASCO 2009. Dr. Eric Van Cutsem and colleagues report that about 20% of gastric cancers carry the HER2 receptor and that Trastuzumab is effective in these patients.
Could you tell me, please, about the study and the significance of it?
What we did in the study is, it was a randomized phase 3 study. We randomized patients that overexpress the HER2 receptor between chemotherapy, classic reference regimen, fluoropyrimidine, that was 5-FU or capecitabine, in combination with cisplatin, plus or minus Trastuzumab. And this treatment was for patients with a HER2 receptor. We looked at patients that had a 3+ on immunohistochemistry or a FISH positive tumor. And we found that in approximately 22% of the patients with advanced gastric cancer, they express the HER2 receptor. And in this group of patients, when treated with Trastuzumab in combination with chemotherapy, we've shown that there was a clearly significant survival benefit. The median survival went up from 11.1 to 13.8 months, almost 3 months longer median survival. And the hazard ratio was 0.74, or translated, this means that there was a 26% lower chance of dying of gastric cancer when patients were treated with a combination of chemo plus Herceptin compared to patients treated without Trastuzumab.
And where do you go from here?
Well, this is an important study because it's a praxis-changing study, because it shows that it's the first biological that improves the survival in patients with gastric cancer, and it's in a targeted population, individualized treatment. From here we can go in different steps. We can look in the benefit, potential benefit in the adjuvant setting. There are no studies yet. They are not yet concretely planned, but that could be an option. Or also we could look build this as a new backbone in the HER2 positive patients and to combine, to look at new drugs to further improve the outcome. Because now in this study we have a median survival close to 14 months. There's still a long way to go, and we don't cure yet the patients with advanced gastric cancer. It's a step forward, an important step forward, a practice-changing step. But we have to do much better, and that are two options. So that's the adjuvant as an example, or a backbone, a new backbone in future trials in HER2 positive patients.
For Global Medical News Network, I'm Neil Osterweil.